Hi guys, so Mrs. Brown has asked me to introduce myself and answer a few questions and talk about how I use chemistry every day at my job. So we'll get right into it. My name is Taylor Cook. I'm a pharmacist. I graduated pharmacy school in 2018, so I have been in the field about 2.5 years now. I chose pharmacy as a career initially because I wanted to do something in the medical field, but I knew I didn't have the stomach to be a nurse, and I knew I didn't want the time commitment that it took to be a medical doctor. So pharmacy was kind of a nice compromise of all the things that I did want in a job. Another thing about pharmacy that appeals to me and a lot of other people is that there are pharmacies and pharmacists all across the country in a wide array of roles. So, like, I work in retail pharmacy, so that's your CVS and Walgreens. My husband is also a pharmacist. He works at the hospital, he works in the ICU and emergency room. But there are plenty of other things that you could do. One of our classmates works in nuclear pharmacy and is responsible for making chemotherapy for cancer patients. You could also work in a clinic or at the VA and help people to manage their diabetes or high blood pressure. You could work in a rehab facility, help people with their addictions. You could work in Washington, D.C. for the FDA, or work in Atlanta and work for the CDC. There really are just so many things that you can do within pharmacy. So the education requirements to be a pharmacist require about 2 years of prerequisite classes that are pretty heavy in biology and chemistry and things like that, math, things like that. I went ahead, and most people go ahead and get a bachelor's degree before they apply for pharmacy school. And then pharmacy school itself is a 4-year program. And then at the end of the 4 years, you come out with a doctorate of pharmacy or a PharmD degree. I use chemistry all day, every day in pharmacy. Pharmacy is chemistry happening in the body. So another name for pharmacist is chemist, if that tells you how closely related the two of them are. One of the most common and easy to think about ways that I use chemistry every day is within drug-to-drug interactions. One of the most common ones that I see every day are antacids used with antibiotics. So antacids contain things like divalent cations, such as calcium and magnesium, and those can interact with the antibiotics. So on the shelf, antibiotics are pretty stable. Once you take them orally, the acid in your stomach can activate them so that the body can use them. But if you have also taken these antacids that contain these cations, the cations can bind to the antibiotics and prevent them from being absorbed and properly used by the body. So a second way that cations can cause drug interactions with antibiotics or other medications is that they raise the pH of the stomach, which is what they're intended to do to prevent acid reflux and other symptoms like that. But by raising the pH of the stomach, which is normally pretty acidic, it can prevent antibiotics or other drugs from becoming activated, which is the state that they need to be in to be properly used by the body. So if any of you have ever taken minocycline for acne or doxycycline for a sinus infection, a lot of times they'll tell you not to take them with dairy, which contains calcium, or antacids, because they can raise the pH of the stomach so much that it affects how well these drugs can be used by the body. We'll practice example for you. Whenever you take Alka-Seltzer, which is sodium bicarbonate, whenever the sodium bicarbonate combines with the hydrochloric acid that's in your stomach, the resulting product is sodium chloride and water and carbon dioxide. And the carbon dioxide is what in the body can raise the pH. Like I said earlier, my husband works in the ICU, and sometimes when people are very sick, they have a condition known as acidosis, which is where your entire body has a pH that is lower than it should be. And this can cause multiple issues in multiple organs. But he says that in really severe cases, he will use sodium bicarbonate to help raise the pH of the body. What I love most about chemistry is knowing that pretty much every physiological process in your body is driven by chemistry. It is chemistry. Everything you've ever had to eat or drink is pretty much just different combinations of carbon, oxygen, hydrogen, and nitrogen. And it's a really humbling moment whenever you realize that chemistry drives most of the processes that happen in your body. What I love most about pharmacy and being a pharmacist is how accessible we are and how available we are to answer questions that people have about their medications. Sometimes you can get a lot of different information or contradictory information from TV or online or a Facebook friend or your doctor. So I like being able to help people wade through all of that information to help them make the best decision for their health. So my advice to you as a high school student that will soon be moving into either the workforce or college is to be passionate about what you do. It doesn't matter what you do. What matters is that you care about it and that you have a desire to help progress whatever field you choose to go into. So I think growing up, I was taught and had this misconception that, you had to be a doctor or make six figures a year or have all of these crazy things in order to be successful and have a real impact, but that is definitely not the case. And so I would just encourage you to, be passionate about whatever it is that you choose to do, and that will take you a lot farther than anything else.